Can probiotics and viruses make teens more confident? Many of you might be familiar with people you know in your life, or maybe even yourself, that have had severe acne, like the person shown in this picture, or this picture, or this one, or even this one. What causes acne? So, as you can see in this diagram here, acne is caused by a backup of oil and dead skin cells in the hair follicles, and it is triggered often by hormone stress or even new products. And it'll make these uncomfortable lesions, as I'm sure you all are familiar with, as we all want to know, how can we fix this? So right now, there are many traditional acne treatments out there, and most of them do have less than ideal side effects. So we start off, this is basically the treatment ladder that is used. Providers will start off by prescribing retinoids, which are topical creams, and in many patients, these can cause extremely dry skin and heightened sun sensitivity. If this isn't working, the provider might move up to topical or oral antibiotics. You might have heard of this concept of antimicrobial resistance, and this is a really difficult issue to solve in the healthcare and in the field of microbiology because the antibiotics we've been using to treat many conditions are no longer becoming effective. So, some other ways to do it without using these are birth control, which can be used in females, but these are synthetic hormones which impact many patients in different ways, such as causing mood changes. Additionally, there is one called spironolactone, which is traditionally used for blood pressure, but it can also help some female patients with acne. But in some patients, this does cause headaches, irregular menstruation, and many other side effects. And then last, many of you might have heard of this for acne is going to be oral retinoids, commonly known as Accutane. So it can cause extreme dryness, nausea. It also has the potential for negative mental health side effects, and it requires very close monitoring by a dermatologist. So based on these treatment options, you might be wondering, well, why isn't there something better that's not so harsh on our body? So this is where the microbiome comes in. These current treatments, they dysregulate the skin microbiome. And what that means is there are many microbes that live on our skin, and these help us to keep it healthy. But these treatments are disrupting those. So, how can we fix this? Well, the answer to many scientific questions is do research. The researchers in this studied a couple of different options. The first one has this long name called peroxisome proliferator activated receptor gamma modulation. So it changes the instructions for the molecules that lead to sebum and inflammatory responses, and those are the main contributors to acne. And some other things they researched were probiotics, which some companies are putting them in their moisturizers, help with the skin microbiome and restore some of those healthy microbes. And then last is something called bacteriophage therapy. So in this next study, it was solely focused on this bacteriophage therapy option. So you might be asking yourself, what is a bacteriophage? And in simple terms, it's a virus that infects bacteria. So basically, it eats the bacteria. This new bacteriophage therapy could be just as effective as the current option when it's used in combination with antibiotics in order to provide a synergistic effect. The skin microbiome has a great diversity of species in it, but in this study, they focused on the bacteria that causes acne, this P. acnes, and P. granulosum. With those in a healthy balance with each other, it was found that those people had healthy skin. However, when those became dysregulated, that was when the patients were seen to have more severe acne symptoms. It also was shown in this study that as we age, bacteriophages naturally can work against the P. acnes. So this backs up what I was discussing before about how those bacteriophages can come in and basically eat the acne-causing bacteria. And so if we implement some of these new research topics, our teens could be all happy like the ones in this picture.